everyone, and welcome to Connecting the Dots with Dr. Ashaye, a great place to be if you desire to take charge of your health and continue to do what you love. So today we're going to be talking all about health insurance and health plans. And as many of you know, I'm a direct primary care doctor, so health insurance is not required in my practice. But I know that there are two major things that affect health in the US, and one of them is access to care, and the other one is cost. So that's something that I've had to take an interest in caring for my patients fully. So today I have Paul Mays, an experienced health insurance agent, here with me, and we're going to discuss health insurance and how to go about picking a good plan. Welcome, Paul.
Well, thank you for having me. I appreciate the opportunity to be on today and look forward to being able to help all I can.
Awesome. Thank you for being here. So you're listening to Connecting the Dots with Dr. Ashaye. I'm Lola Ashaye. I'm a family medicine and lifestyle medicine doctor and owner of In Touch Primary Care here in Sugar Land, and we offer stress-free healthcare with direct access to the doctor. You can find more information about us on our website, intouchprimarycare.com. So let's get right into it. So Paul, can you share a little bit more about your experience as a health insurance agent? How long have you been doing this? How do you serve your clients?
Absolutely. Thank you for the opportunity. So I've been in the health insurance industry for the last 6 years. I specialize in options for individuals, families, small businesses, and those who are self-employed. Really anyone that's paying for their own insurance. I try to better understand someone's situation and customize a solution to really fit their needs and budget.
Okay. Yeah, so that's definitely very helpful because people that have to pay out of pocket for their own insurance understand how painful that is. So, having someone help them through that process can be, just priceless. Okay, so we're close to open enrollment, and many business owners are thinking about what to do next year or what to do going forward. Can you explain a little bit more about how that works?
Yeah, so open enrollment's the time of year where someone can enroll in a marketplace plan through the government. It basically begins November the 1st and runs through December the 15th. And anyone that selects a marketplace option during that time frame, their plan will start on January 1 of the upcoming year for 2024. If someone's currently on a marketplace plan, and that plan will end on the 31st of December. So it's really important that they take advantage of that open enrollment window and reselect a plan for the upcoming year. All of the marketplace options operate on a calendar year basis.
Okay, so yeah, so with open enrollment, a lot of times that has to do with the government insurance, the marketplace insurance that is available to people. But there are different types of health insurance plans and different types of health plans in general. What are some things that people should consider when they're picking those plans? How would you recommend they start, for example? And there are a lot of terms that, people throw out: deductible, co-pays, co-insurance can be confusing. Can you kind of help us simplify, define some of those terms and make sense of it for our listeners?
Yeah, absolutely. First and foremost, when considering a plan, there's several factors to keep in mind, as you mentioned. But first and foremost, really find an agent that you can trust and that's going to have your best interest in mind when selecting a plan, and kind of help you walk through that process and explain what liabilities you may have based on the structure of the options that are available. Some of the main factors to consider are your deductible, your max out of pocket, what is your co-insurance, your co-pays, as well as the network of specialists, doctors, and hospitals that are networked. Some people may ask, what is a deductible, or how does a deductible work? A deductible is the amount of money you will have to meet before your co-insurance actually kicks in. So for example, if you have a $5,000 deductible, you may need to meet that $5,000 worth of upfront expenses in addition to your monthly premiums until your plan starts to help you additionally. You may also ask, what is that coinsurance? Coinsurance is basically the percentage, coinsurance percentage that the insurance will pay in combination with you. So for example, if you select an 80-20 coinsurance, and that's the most popular, that most people like, is an 80-20 coinsurance plan, you'll have to meet your deductible first. So if we still use the example I previously mentioned of $5,000, once you meet that $5,000 deductible, then your plan will start paying 80% of those bills, with you paying 20% until you actually reach your max out of pocket. So really important in selecting that percentage. Some plans are 70-30, 60-40, 50-50. You really want to lean towards 80-20, 90-10, the best you can get, so that when you meet that deductible, you get the help that you need. You really also should consider, what does my plan cover before I actually meet the deductible? Normally on a lot of plans, preventative is covered before you meet the deductible, but is there anything else? And the reason why I think that's important to mention is because there are plans that are designed that basically cover preventative only until you meet the deductible, meaning you don't have copays, which would mean that it won't even help you with the doctor visit or prescriptions until you actually meet that deductible. So you want to be careful to make sure that you take those things into consideration. And also a copay, just so you're aware, is a specific amount that you will pay for a specific service. For example, you may have a $10 copay for generic prescriptions. Well, when you need a generic prescription filled, that's the amount you're going to pay. So having copays is important on a plan versus them not being covered until someone's met a deductible. So having the copays are definitely important. And then others, really need to think about when they're selecting a plan. If, for example, you have a procedure that's planned, for example, a hip replacement that's needed the upcoming year, or if you have an injury and a known surgery is coming, you need to be really careful in selecting that plan. You probably need to consider paying more per month and picking a plan that has a lower deductible and or a lower max out of pocket, because you're going to meet it with that upcoming procedure. So just helping you through that process. And that's what we do as agents to make sure that you're making the best selection for your family. When I talk about networks are important, I want to remind you that it's very important to stay in network with the plan. And staying in network with the plan is going to the doctors and the facilities that have contracted rates with that specific provider. And you want to stay in network. Some PPO options, you can go in or out of network, but it's always best to stay in network, because you don't want to lose the network contracted rate, if you will, if that makes sense. So those are all things that I feel like are really important when selecting a plan, and just making sure that the agent you're speaking with is being transparent with you and letting you know where your liabilities are based on that plan that they're offering.
Right. Thank you. That was very helpful, because I know a lot of those terms are confusing. And so there's a lot to consider. So when you're choosing a plan, I think that's the summary of it. And having somebody to help you through that process can be really helpful. So it's not something that you should just pick without, going through all the options that you may have, and don't just guess, basically. It's good to talk through it and understand what you're picking, so that you're getting the best plan for yourself. And the other thing about it is, don't just roll it over, because things change for the next year. Like you said, if you're anticipating more health expenses one year, you may want to relook at your plan and make sure that it's going to fit for that next year. All right. So I've heard a lot of people say insurance is a scam. I hear that a lot. And some even decide not to get it and just take their chances. Why may that not be the best approach? And what options do people have to cover their health expenses?
Well, first of all, I'd like to say you're absolutely correct. Some people do feel that way. I honestly couldn't disagree more. I feel like everyone should have health insurance. There's a lot of different types for different situations. You know, I've even had a situation where I had a client call me originally and she signed up her spouse and children just due to cost. And she said that she's not going to insure herself because she's extremely healthy. She runs marathons and is very fit. And I encouraged her to get on that plan with them, and she didn't. And it's unfortunate, but just a few months later, she called me back and said, Paul, I've been diagnosed with breast cancer and I'm not sure what to do. And in that exact situation, my heart went out for her, but your options are very limited if you don't have health insurance and you wait until you need it, meaning you have a critical illness or something that's happened and then try it at that point. They're really your only options at that point are to get on a group plan through a spouse's work or find a job that offers coverage that's guaranteed issue, meaning they'll allow anyone to get on no matter what pre-existing conditions they may have. Or if they're in a position where open enrollment is near, like it is today with November 1st coming up, if they're that lucky, they would have that chance to get on. Otherwise, they have to wait till the next open enrollment to be able to get on a type of plan like that as well. I really never recommend going without health insurance. Some people feel like they pay for it every month and they rarely use it, you know, but in some cases, if you don't have health insurance, you can actually go bankrupt due to medical costs. In fact, it's one of the most common reasons for bankruptcy in America these days. And I think everybody should have it for sure.
Yeah. So yeah, I agree. So the other thing that I think people don't always understand too is that, you know, there are health insurance, but there's health insurance. There are also other health plans that people can have that may not fit the traditional health insurance mold, but will pay for medical costs, you know, if they were to incur them. So sometimes people look at the price of health insurance, especially business owners and they don't want to pay that price or they can't afford to pay that price. But knowing that there are other options outside of traditional health insurance, I think can be helpful for people as well. So as you know, I'm a direct primary care doctor, and we have a lot of benefits for our patients, easy scheduling, same on next business day appointments. They can call, they can text, email me directly when needed. They have access to video visits, and you know, they actually get health care, not a promise of care, which you get with health insurance, right? It's not actually health care. It's just you're going to get. So that's the membership. But I've had business owners that have employees where they are trying to figure out how they can take advantage of this membership plan that we offer and how they can potentially have savings with either an existing plan or a new plan. Do you know how would they do that? So a business owner is listening, they like the membership idea, all the services, all the things I just mentioned about how we're set up, and they're thinking, okay, I have health insurance, or I want to be able to pair this with health insurance. How would you go about, you know, helping them with that?
Right. Well, first of all, I want to tell you, I love the services that you offer with that membership and clients having that easy access to their personal doctor, which is amazing. And I think that for those businesses that maybe they can't afford health coverage, as you mentioned, having a membership and pairing it with supplemental products as well can help them reduce their overall cost. The main reason why people get health insurance, and you know, even in addition to a membership, is really for those catastrophic situations, you know, major accidents, life-threatening cancer, heart attacks, strokes, those things we worry about most, if you will. And you know, having you know, a plan that's going to help you with the catastrophic type items and a membership is actually going to help them overall. and their employees are going to love them because they're going to have easy access to the doctor. It's not every plan out there is perfect when it comes to making appointments, and some plans out there you struggle a little bit to find an appointment in the coming days, right? So having access to a membership like that is really crucial to helping them and can help reduce their overall cost. Every health benefit a business offers to their employees really helps them with their retention. It helps them keep those employees coming. So if they're at a point where they can't offer full traditional health insurance, pairing something with their membership that you offer is a great option for them to be able to save money and keep their employees happy at the same time.
Yeah. And that's what we found too for the businesses that are with us. They're pretty happy because they've saved quite a bit of money that way. And also that they have easy access, which are the top two problems, I believe, in the healthcare system today. So is there anything additional you'd like to add? Any tips or anything to reduce costs, for instance, that people might want to know?
Yeah, I would say I think a lot of people struggle with the cost of prescriptions these days, so there are a lot of programs that are out there that many people aren't aware of. They might know about GoodRx or one or two other options, but depending on their income, there's a ton of different programs. On my website, maysInsuranceGroup.com, there's a resources tab that can walk you through several options. So if you know somebody that's taken a medication that you see on a commercial, it's probably a medication that's costing them quite a bit on their plan, depending on what type of plan they're on, whether it's tier 2 or tier 3 medication. And those resources can actually help them so that they can get the prescription they need for whatever situation they're dealing with. Plans can be customized for you. You no longer have to pay for a plan out there that covers maternity if you're not in your childbearing years anymore, right? So you can need an agent that's going to customize a plan and tailor it to you and your situation to put you in the best position possible, so that you're not breaking the bank, if you will.
That's very helpful. And I think that that's more and more important these days, where people, it's not like before where you just get, a few options. Like now there are many, many plans and many, many ways to go about paying for healthcare. So it's good to have an agent help you through that. So how can people find you?
I'm actually located in Stafford, Texas, here in Stafford. But they can find me on social media, whether it be Paul Mays Health Insurance Group, pretty much on all social media platforms and search engines, whether it be Facebook, LinkedIn, Google, Yelp, you name it. Pretty easy to find me, Paul Mays Health Insurance Group. And I'd love to be able to, identify whether or not you're in the best spot possible. And if you're in a good spot, I'll tell you that I would recommend you staying exactly where you are and don't make a change. For me, it's not about, trying to push one carrier over another, which carrier pays the best commission. For me, it's about doing the right thing for people to make sure that they feel good about the agent they're dealing with, so that in the future they'll send their friends and family. For me, it's just all about taking care of people. And that's what makes me sleep well at night. And that's really why I'm in this industry, because when I left my previous industry after 30 years and I learned what COBRA really meant, it inspired me to say this system might be a little broken and there's got to be a better option out there. And that's kind of why I started doing health insurance. And I really love doing what I'm doing. So anybody that's been introduced to some of those terms, COBRA, fully understanding the impact that met me face to face when I left my previous career.
Yeah, that would definitely do it. I can imagine. Yes. Yeah. No, there are many reasons that, people need this information, because the system is broken, and it's helpful to have people hear how they can, still thrive in the system. So thank you for being here. This was great. And to our listeners, if you found this helpful, if you're in the Houston, Stafford, Sugar Land area, I want to invite you to our upcoming open house. It's going to be Next Thursday, October 19th, we're going to be there from 12 to 4. Paul is going to be there too. So, and Liz, I talked to her last week. You can check out that episode as well. We'll be there as well. And we have other agents that could help you sort through some questions you may have. If you can't make it, you can go on our website, intouchprimarycare.com, schedule a 15-minute free consultation. We can walk you through more information about our practice and about how you can connect with the other agents. So thank you for listening. And if you've liked what you heard today and you're looking for a primary care doctor, you can go to our website, and you can also check out Paul's website for all the resources that he mentioned earlier. So have a great day, and we'll see you next week. Bye-bye.